This meeting is being recorded.
Um, we talk about pushing this message through the channels that are most likely to reach your audience and to monitor the results and adjust accordingly. And it's a process of developing audience-informed communications that doesn't change during a time of crisis. Everything that you already know and are using about how to communicate with your audience is as relevant today as it was a couple weeks ago. You already have the skill and the ability to communicate with your audience during a crisis. I know you do. It may feel overwhelming, but just remember that. What does change is the content of what you're saying. And it changes because the people that you care about, the people that you serve, need to know right now that you are here and that you care. You don't have to have all the answers in a crisis, but a clear, persistently communicated demonstration that you care is necessary for as long as the crisis continues. Silence is not an option during a crisis because silence is interpreted as indifference. You want your audience to trust your organization, to see you as a source of information and resources and of community. And the longer you allow silence to continue in a crisis, the harder it will be after the crisis to rebuild trust and community because you didn't come through when you were needed most. If you don't know what to say at this point in time, if you don't have the answers that you wish you had right now, I recommend putting out a carefully crafted standby message that, in your own words, communicates that you care, that you're trying to figure it out, that you'll be in touch, and talk about your approach. For example, we are working with local health authorities to whatever the end of that sentence might be. And it's this issue of care, which is the reason why you see messaging coming from organizations saying your health and safety is our top priority. That's a message of care. And it's something that's coming from just about every organization right now. And you can think about content during a crisis being one of two types. It's about the communication to your team or your staff in-house. And secondly, it's about the communication that's externally facing, that is a really essential part of meeting your goals, but might skip right over your original goals of what you wanted to say and focus on what your audience needs to hear from you right now in terms of information and resources. So we're going to talk a little bit about those two types of communication to give you a framework for considering your communications during this time. And then we're going to talk about the 5 essential things to keep in mind for communications during COVID-19 and open it up to your questions. So last week I gave this presentation. We decided to do it twice because there was such a great response. And last week I wasn't talking about internal communications at all. But one of the things about crisis communications is that they are changing constantly. And one of the goals of the TA network really is to be a source for gathering that information that might be helpful to you and presenting it in situations like this. So I've really been watching what people are saying about crisis communications. And over the last week, the past several days, the news has been filled with stories of American employees who are playing a critical role in the current crisis. And this has now impacted all organizations. If you think about Instacart, you may have heard about them on the news. Their organization is actually being pretty damaged right now during communications because they are not taking care of their employees. And it is their employees who are speaking out about that. And it is now a situation where all of us are starting to get a bad feeling about Instacart because of the way that they treat people. So I've started to see organizational communications have that message of care and added to it is how they are addressing their employee needs. This is important for a couple of reasons. One, always remember that your employees are play a key role in your communications, in your word of mouth communications. They're touching many more people and organizations than you are as an individual, as a leader, or as a communicator. So the more positive things that your staff and your team have to say about your organization, um, the more that feeling of care will spread throughout your community. And also because it's become an expectation that people are paying attention to their teams right now. And Sarah, I'm going to ask you to post a couple things in the chat. One is an example that has gone viral of the CEO of Marriott, Arnie Sorensen, speaking to his team. And one of the questions I've heard about this is why is communication that was intended to be internal, focused on their employees, now become public? And it's because they're reaching their audience through their employees. If you listen to what Sorensen had to say, it's pretty interesting 5-minute video. And you get a really strong feeling about Marriott, which I really didn't know before, listening to that. And you get the feeling that this is an organization that is really to be trusted in this time of crisis because of how they're treating the people closest to them. And Sarah, I'll also ask you to post a link to a letter from a nonprofit CEO, Amy Sample Ward, who runs really the biggest nonprofit leadership conference around. It's called the Nonprofit Technology Conference. And one of the things that she says, I'm going to read you a quote from her. She says, I know that things are scary right now, but we're less afraid when we can be together and can work together, even if it's over the phone. Before you do anything else, center your people, prioritize your staff, because without your staff, it doesn't matter what your mission is, because you don't have anyone to carry it forward. Gather them, talk to them, be honest with them, create a space for solution finding from them, and be together in the muckiness for a while. Whether you're facing hard decisions about having to cut hours, cut programs, or otherwise change plans, don't make those hard decisions alone, even if it feels like it's the right thing to do as a leader or a manager right now. Center your staff and much together. So what you have to say both to your team, whether it's a team of 3 or a team of 300, and what you say to your public about how you're treating your team have become really important parts of your communication. And then secondly, communications as an essential part of your organizational goals right now. Let's really make this concrete as an example. Perhaps one of your organizational goals into your grant is to increase access to mental health services for children, youth, and families. And perhaps, as a lot of communities have, you've determined that one of your communications goals around increasing access is to launch a social marketing campaign to reduce stigma. What the current crisis means for those planned communications is that you might still occasionally put out a little bit of content right now that can help reduce stigma, but it's no longer the primary focus of your communications. The primary focus of your communications should be around access to mental health services for youth and families, yes, but it will be about how they get access right now when a lot of services are closed, when the government is limiting our face-to-face contact, when transportation systems are down. As your organization and community make decisions around access, your audience needs to know that you're here, that you care, and that services are available. And your communications serve to answer the question, how do they get access? By necessity, your communications become a kind of a literal nuts and bolts information providing essential function. But it's very much in support of your original organizational goal of increasing access to mental health services. Your audience maybe stayed the same or got broader. because more people are going to need access to that information, and more people are being impacted. Their mental well-being is being impacted by the current crisis. But what you know about that audience is still relevant to keep in mind while formulating your communications. And in regards to those previously established communication plans, that original social marketing communication plan that you were going to launch about reducing stigma, before you disseminate those, consider right now how they will land on your audience and how it will impact your organization. Will you appear tone deaf by putting them out right now? Will they have the intended result? Or will they simply get lost in the avalanche of COVID-19 communications? There are lots of examples as well of places where communications may not feel as connected as the example I just gave you to your organizational goals, but will kind of focus on what your audience needs from you right now. And that may not feel so closely aligned with your original goals. So Liz is going to jump in at this point and talk about her experience and about some tips to keep in mind, and about that issue of focusing on what your audience needs to hear. Liz?
It off. Thank you, Michelle. Appreciate it. So let's start at the beginning. There are 5 tips that we want to talk about. And in talking about these 5 tips, we want to make sure that you really stay focused on who your audience is and what they need to hear right now. These communications may not be who you normally communicate with, or may not be the same group or the same message, but it's important to recognize who needs to hear what now. So the first thing you want to do is be a connector, right? You want to connect to people. We'll talk a little bit about that. All of this is about empathy and understanding where people are right now in their, no matter where they are and where their organization is, or where they're living or what's happening. We want to make sure that we really are communicating empathy. We don't want to hesitate in our communication strategies. We want to put it right out there. We want to talk to people. We want to listen to people, which is the most important thing about communication right now, is to hear what people are experiencing, what their challenges are, and where they are in terms of the process of trying to solve some of those challenges. We want to remain forward-looking, and I'll talk a lot about that in a minute. And then we want to connect leaders and communicators, and I'll talk about that as well. So those are the 5 tips. We're going to walk through them right now. The first is be a connector. Part of the work of communicating a crisis is really connecting to who you need to connect with, who's going to need you to hear from you the most. So in 2012, when Superstorm Sandy hit New Jersey, and it was a devastating storm, not just for New Jersey, but certainly for New Jersey. I'd been on the job for about 3 weeks. And with that, we were managing a lot of transitional challenges. There were a lot of things happening in October 2012 that we were trying to work through. And then Sandy hit. That sort of said to us, take a breath, and we really need to figure out what's happening. The goal for me when Superstorm Sandy hit was to connect with people, to find them, to figure out where our youth were, where families were, where my partners were in this work, what they were doing, what they were struggling with, what did they need help with, what barriers to care were they experiencing. And so we really tried to figure out how to do that, because what's different then versus now is we had no means to communicate. Our phones were down, cell phone towers were down, we had no internet, no power, no gas. So it was a different type of challenge than we have today. Because today, although we really don't have the ability to connect from in distance, right, with each other, we have the ability to connect virtually, right, as we are right now. So we want to start all of this work by really figuring out what tools do we have available to us, and how can we solve the biggest challenge for us right now, which is how to connect to the individuals for whom we serve. How do we get to youth and understand what's happening for them, what their experiences and what their challenges are. So we want to think about our audience, right? And what do they need? We want to do a couple things that I think are really important in terms of this. We want to think about what resources they need. We want to think about how they're going to implement those resources. How are they going to get to those resources? We don't want to let our audience search and sift through the big amount of information that's out there. We want to get right to it, right? We want to put it right out front, help people find what they need really quickly and connect to those things really quickly. And we want to use our best tools in order to get there. We want to think about this not as business as usual, but we do want to think about this as what will it look like later too, right? So we're really keeping our foot in one place as we're moving to the next place. As an example, when we were experiencing the aftermath of Superstorm Sandy, we were not just thinking about how do we make sure that children get, as an example, mobile response and stabilization today when communications are down, but we were thinking about what's the impact of this storm on the youth and families and what's going to happen 6 months from now as we read and learned from people who had experienced other storms like Katrina and the aftermath of Katrina, where 6 months later, there was a significant increase in the number of children who required some behavioral health treatment. And we were preparing for that. So you want to be thinking about that as you're this connector to and figuring out who's who. Empathy. Because most of the people we're talking to today come from the world of social service and work with each other, empathy is something that you demonstrate on a regular basis, but we really have to kick that into high gear now. We really have to find, as we sift through our own stuff and trying to figure out how we're going to get groceries and how we're going to deal with some of the challenges ourselves. And by the way, I come to you from New Jersey, which is a pretty big hotspot for all of this today. And I had to stand in line just recently to try and get some groceries myself. We have to remember that the individuals for whom we serve and our partners in this work are going through that too. And we have to move past our own stuff and get to a place in which we can be helpful. And the only way I think to get there is to really connect to the people who help you get there, right? So you want to use your thought partners, you want to use your friends in this situation to talk through, to vent to do what you need to do in order to get to the next place. Use your values-based language to help people understand where you're coming from. Systems of care language change this all for all of us, right? We want to come to the bottom line to help people understand who we are and what we're coming to do to help, right? We want to be straightforward in this work. We don't want to talk about this virus in this huge terminology, right? We don't want to talk about it as the pandemic and the epidemic and emergency and crisis and all of those other words that you're hearing all the time. We want to talk about this as what it is. COVID-19, that's what it is. Our job is to get us from here, where we are today, to help people stay safe and then help us figure out where they're going to go in the future. Great. Don't hesitate. Don't hesitate to communicate, get information out, get it out now, talk to people about what you know and what you don't know. Don't be afraid to have conversations in which you learn things from people who, in terms of what their challenges are, what they're going through. Resist the impulse to wait until you know more, right? We're never going to know the whole story. And so let's not wait for the whole story. Let's get to people to help them understand how they access what they need, how they get to where they're going, so we can actually be really good helpers within the context of this work. And use all of your channels to get there, right? Use all of your partners to get to every place that you can get to. In other words, this should be a tiring time because we're communicating all the time, not because we're not, right? So I'm trying to connect with people on a pretty regular basis. I use text, I use email, I use the phone itself, old-fashioned, but that's who I am. And virtually, we're working to get to people. And now, a really important component of this work is look forward. It's really easy to be stuck in the moment, to be stuck here where we are today, right? To think about this as, oh my God, the world's falling apart. I try not to do that. First of all, it's not helpful for me. Secondly, it doesn't get us where we're going. And we need to recognize that the current situation is fluid. It will change. Things will change on a regular basis and things will feel like they're getting worse before they get better. However, when our system of care values are driving the work that we do, it helps us make decisions about what we need to do, where we put resources, who we communicate with, and how we're going to do that. And it's important to use those values in order to make decisions. As an example, in Superstorm Sandy, we knew exactly who we how we were going to take those federal funds and who was going to get them, because we used our values and our data to tell the story of what we needed to do. So use the system of care and system of care values to drive your work. Implement continuous quality improvement strategies right now for anything new that you're doing that's innovative. There's a lot of innovative work that's happening right now in the use of technology, in telehealth, and all kinds of other strategies that people are using. But first of all, we'd like you to share them, talk it out. We'd also like you to think about using thought partners in the context of this work to help move things forward. But track it, pay attention to it, see its impact, talk to the people who are experiencing these things for the first time, and let's see whether or not these strategies, these innovative strategies that you're using now, are going to be helpful for folks in the future. Prepare the next steps, each step in the process. In other words, you want to be 2 steps ahead. Implementation is always 2 steps behind where you're thinking things are going to go. So be thinking about that. Be attentive to that. Be attentive to what youth and families need and how they're going to receive it, and make sure that you have feedback somehow or another that's going to get you that information. And be prepared to address the needs of youth and families who have experienced loss. This is a grieving process for all of us in terms of what daily life looks like and how we experience daily life. There are people who are losing family members and friends, and the heaviness of that is going to be important for all of us to be prepared to address as we move forward, because there's a delay in our ability to grieve some of this, in particular to grieve together as communities. So we have to bridge those things as much as we can and recognize that there's going to be a tremendous amount of work to do in the aftermath. Focus on what you can do to help families and children recover now and in the future. So be very attentive to that. And number 5, connect leaders and communicators. We know that there are leaders who don't communicate that well. We also know that there are communicators that communicate from every level of the work that we do. Put them all together and make sure that those communicators are leading the way and helping people to understand what's going on. I often talk about translators within the work of systems of care. And those are people who speak multiple systems, not multiple languages in the traditional sense, but they speak different systems. I speak juvenile justice, I speak child welfare, I speak systems of care, behavioral health, intellectual development of disabilities. All of those languages are really important. And we want to put our best communicators out front to help people understand what we're trying to communicate, what our message is. Communication plans and direction should be shared with leaders. So we want to make sure that there's a unified, universal organization message, right? We want to make sure that message is clear. And to Michelle's point, that everyone is communicating the same thing. This is the best time for us to innovate and to demonstrate people that we are here, available, willing to help, and that we are great partners within the context of this work. And then we want to designate an editor, and I forgot to do this the other day, which is, and got something out that wasn't quite what I meant it to say. But so designated editor, and remember, we're all moving really fast, and because we're moving fast, we make mistakes. And so we need partners in this work to make sure that our work makes sense and will be helpful to the people for whom we're working with. Those are our 5 things.
Great, thanks, Liz. We would be happy to take any questions that you have, but also I think it would be meaningful to everyone on the call if you have been communicating about COVID-19 either on your social media or your email or your website. Please post a link in the chat and share with other participants. I think that will be great. And we'll be happy to share the launch of our new webpage soon. We're having an interactive map where you can click on each state to learn about telehealth guidance being relaxed during COVID-19. So you can click on your specific state and learn more. And as we're waiting for a few questions to come in, Liz, I have a question for you. Could you talk a little bit about how you dealt with internal communications with your team and the impact that it had?
Yeah, absolutely. So the first thing is that during Sandy, it was incredibly difficult to communicate because we had no cell phones. We could communicate only through text messaging, which in typical state fashion, we weren't allowed to do. right? We weren't allowed to text. And I just got my brand new BlackBerry. That's how long ago it was. And I just gotten a few days, and I said, I'm going to break these rules, and the state is going to do whatever they're going to do. So the first thing I needed to do was to make sure that I had the ability to communicate with my whole team, right? My team I communicated with daily, every day, first thing in the morning, sent them text messages, checked to see how they were doing, to see if they had heard from people, what were they hearing on the ground. And to Ash, though, we really needed to be attentive to the safety factors for where they were all at, right? So the state had been impacted in multiple ways. We had a major storm that hit the shore towns. I'm from New Jersey, so they're not beach towns, they're shore towns. Those shore towns, the houses were damaged. So there were people in that part of the state who had different challenges than in some of the more rural parts in which there were trees down and the roads were blocked. So we needed to figure out where people were at. Where are you? How is it going? What are your challenges? You know, our commissioner couldn't take a shower in our own house because they had no access to water. So how does that get managed? And then the next thing is, so first thing we want to do is make sure, are you taken care of? What do you need to be taken care of? And what do you need from us so that you can be okay? The second thing is, okay, for those who are doing well, I was the first one to have power back on. So, which was great for me. But it also meant that I was then responsible for making sure as much communication got out as possible and that we were connecting dots and keeping track of those innovations, watching for the CQI components that were happening. So all of that was really important. But the daily communication with my team was essential in order for us to make sure that we got all the resources where they needed to go. And people move in ways that are really amazing when they know what they're supposed to do and they have a sense of what the purpose of that work is. And so that's how we managed through the course of Superstorm Sandy. And we kept those meetings, by the way, those Superstorm Sandy meetings for a long time, even after we were back in the office. Things seemed to go back to normal because we were watching for the next wave of what was coming.
Thank you. And I want to introduce Anita Bryant, who is our lead social marketing specialist. I think Anita's keeping an eye on the chat and is going to let us know if there's any questions.
Yes, I am. Right now, they're just sending some stuff over. We'll have a few. So if you guys have any more to add, some people are just submitting them in right now. So you guys are doing a great job, just getting a lot of information.
Thank you. The one thing that I would add about internal communications, just having done an outline for our executive director, is that I think that some of the most important things that your team needs to hear right now is to acknowledge the challenges that they may be facing, as Liz was talking about, acknowledge their efforts and their work and the impact that that work is making, even though they're facing challenges. And talk about what you as an organization are doing to care for them. And then what you as an organization as a whole are doing to meet the needs of those that you serve. And bring a little optimism to the future. We can't promise our teams that things are going to be okay, or the people who are watching our public communications, but we can promise them that we're going to do our very best to help find answers.
Great. Well, we have a question from Dylan, and he is asking, did you find any specific COVID-19 information flyers or informational graphics that you found useful or educational that you shared, or which some that you obviously may not want to share?
So I think we do have some resources that might be helpful. We certainly have some resources around working with the intensive in-home kind of work, some guidance around that. Denise also talked about some specific documents that are helpful that'll be posted in the chat. So hopefully there's a few things that you might find helpful.
We also have, as I mentioned, the state-by-state guide that's coming out probably later today or tomorrow around telehealth restrictions being relaxed, and some guidance about HIPAA-compliant technology that organizations can use. So we'll be sharing that as well. And I think in terms of, Dylan had asked about graphics. I think, Liz talked about not using words that like epidemic and pandemic that elevate anxiety, but also to steer clear of graphics that are takeoffs on molecules. Actually the university the University of Maryland is posting a lot of that kind of stuff, and the questions I've heard around it are, is that what it really looks like?
Mhm.
And the answers I've heard have actually been that COVID-19 has no color, that people are coloring those graphics red and orange, which are really alarming colors, in order to help us see them, but that they themselves are not red, so they're not an accurate representation of what they are. And I've seen a fair amount of stylized molecular graphics. I don't think that that helps calm people.
That's right.
So I think sticking close to your organizational brand is important.
Great. We're waiting for a few more to come in. I know during the last call, someone mentioned more about the importance of partnerships and how to utilize that, especially when you're limited some of the resources and technology reaching families that may not be online or have that type of communication. Can you elaborate a little bit more on that?
Yeah, absolutely. I mean, I think that one of the biggest things that can be helpful to people are the partnerships that generally folks really work hard to establish as doing system care work, right? It's a guiding principle, is building relationships not only with the youth and families themselves, but also with communities to create opportunities for youth to re-engage back into community instead of going into higher intensities of service, right? So that's a core system of care value. With that, when there is, when things are challenging, it is time for us to rely on our partners and to come together and think about how is it that we serve particular populations and how we make sure that everyone is taken care of. And so the first thing I think it's important is who does have access to all of the tools that we're talking to, the virtual tools, and their ability to connect, and then who isn't able to access those, and how do we get communication to them? And there are multiple strategies to use, including, do they have access to an old-fashioned telephone, right? A landline? Do they have a cell phone that we need to work to get them extra minutes and extra time that we can use to communicate with them? Is it an area in which there is no Wi-Fi access? And can we use a thing like a MiFi to go in and to open up access for them? Do we need to think about having those individuals connect with somebody else so that we can meet them someplace else and meet them outside, following the CDC guidelines in terms of how do we keep distance and stay apart? But each one of those situations that I just talked about require us to really think about how we're going to do that as a team. Who else do we need to bring into the table? Who can partner with us on it? Are there space available that we can use? Who community is going to help us figure that out? In Superstorm Sandy, we had to figure out things like who can help us rebuild houses, because some houses were done. I had one family, we couldn't get actually in to see them because there was a bridge to their house that was out, that we had to figure out how do you get that built in order for us to get. And in the meantime, how do you help them get supplies? How do we communicate? So you want to bring a team together and all the partners that you think can help you problem solve. And then when you need to, you want to bring a thought partner in who might help you think even bigger and broader than what is just in front of you. So those are the kind of things to think about.
Great, thank you. And we have some questions coming in. We have Lauren asks, what words would you like us to replace with epidemic?
Yeah, that's a good question. So what got me thinking about this was I was editing one document from our organization in which COVID-19 was referred to in 5 different ways in that single document. And when I was done reading the document, I mean, my own anxiety level was up. So I think that we all know it's a pandemic. We know it's a public health emergency. We know it's an epidemic. We know it's a disaster. But not to remind people of that in a document that's focused on providing resources or information to simply call it COVID-19. And people have asked me, how do I talk about this time, like during this time? You can simply say during COVID-19 or during this time or during this challenging time even, but to avoid language that's gonna serve no other purpose really than to elevate anxiety. Stick to what's helpful to people in terms of information and resources.
Let me just add one quick comment on that. So I keep talking about Superstorm Sandy. I have to say that when we called it Superstorm Sandy, that was really anxiety provoking, right? We knew it was huge. We just wanted to call it Sandy, and we did just call it Sandy in all of our communication, except when we had to call it Superstorm Sandy for some of the other things that were necessary, including how we describe federal funding, right? So I think to Michelle's point, it became huge, right? This idea, it was the biggest storm to hit in over 100 years, and it was 3 separate storms that hit at the same time. And so that's the kind of thing we don't want to raise the anxiety. We want to say, hey, look, we got this, right? We're going to work through this. There are steps we have to take in the process to get there. But I agree, COVID-19 is the best way to describe it. It is what it is. It doesn't make it bigger or worse. It just is what it is.
Thank you. And we have another question from Sydney. She is asking, you discussed building collaborations with other leaders. How can you move forward with that collaboration when the other leaders are focused on what is not available instead of how we can support families and move forward?
Sure. So that's always going to be a challenge. It's a challenge today. It will be a challenge tomorrow. It'll be a challenge in the future, regardless of what's going on around you. The goal for all of this work is really to help bring people along with you, right? And so how do you help them understand the priority? So for me, I ground really quickly in saying, okay, what can we do? What is possible? What is possible today? And how can we get there today? And always ground people in that work. Also, I think the ability to articulate what youth and families themselves are saying in terms of what they need is important. And any way you can describe that, whether you use data to describe that, whether you use their personal stories to tell, their words to tell what's going on, any way you can bring and elevate that conversation is important. But when leaders, and I certainly was in a position in which leaders only wanted to talk about particular things, and my job was to actually continue to bring what the challenges are, but here's the solutions, and these are the things that we really need to work on together. And this is what I need from you in order to accomplish these goals.
Yeah, that's a really good point, Liz. And I think that leaders, like everybody else in a time of crisis, feel worried. They may not actually have the answers, which is why it may be hard for them to move forward, to focus on what's possible. So even with our leaders taking a little time to listen, and then, as you said, to help them move beyond, the current situation, their current fears, to what could be possible, and based on what families and youth have to say about what they need. That's always a great place to start.
Great. So I have a question from Dylan, and it's the first part of the question is for you, Michelle. It's when exploring the example of increasing access to mental health services and creating a social marketing anti-stigma campaign. You had mentioned doing a sort of nuts and bolts information campaign in order to help the community right now, and also to be working towards a larger project goal. Would you be willing to explore further what the nuts and bolts campaign would look like? And the second part is for you, Liz. If you can mention what are some of the basic information that people most affected by Hurricane Sandy needed access to? So, do you guys have that?
Yeah, great question. That's a really good question. So the part about nuts and bolts information providing campaigns. So what I mentioned by that is that all of us in Children's Services play a role in being a convener or a hub, as Liz was talking about. So don't leave the families and youth that you serve or the workforce alone to sift through this deluge of information that's coming our way and find the answers themselves to the questions that they have, but be the person who brings together those resources. So your website or your social media may not have been a place typically that provides information about local transportation. But given the fact that local transportation has become so limited, that might be a great one of the things that families and youth need to gain access to resources. So if you are putting together a resource page where there's information about how people can gain access to services and you feel like transportation needs to be a part of that, then fold it in. Don't make them go look somewhere else for how they're going to get to your services, but be the place where they can find all the answers. Make it easy for them to get the answers that they need, rather having to go and find them from different places. Your organization can play the role to be that. So that's kind of an example of that is what we're trying to do at the Institute. We're calling our campaign Managing Now for a Better Tomorrow. If you look at the kind of resources that people are putting out, it's often just a web page with COVID information. But what we're trying to do is gather resources so that you in the field don't have to go search them out, but that we're doing that for you. And finding resources that you really need. And hopefully that will be helpful to you in managing today and also thinking through what tomorrow could look like.
Okay, so my part of the question is, what were some of the basic things that we thought youth and families needed to know during Sandy? So the first thing that we were concerned about is parents and caregivers were pretty well traumatized by the whole experience. And so because they were traumatized and they experienced anxiety around working and getting back to work, how do they take care of their children? When's school going to open? Can we get food? Does some of this sound familiar about some of the challenges we have right now? Our first thought was, how do we take care of the caregivers by sort of holding their hand, trying to get basic stuff to them, including supplies, basic supplies. Where do they get diapers? Where do they get wipes? Where do they get food? How does all that happen? And then the next thing that we really need to think about was making sure that our parents understood what the signs and symptoms of trauma look like for their children, right? And so we went to pediatricians and we went to schools, and we provided a ton of education to all of the adults who would be working with children, including parents and caregivers. This is where peer support was so incredibly important in getting information out. The family support organizations in New Jersey did such a terrific job of getting information out to families, both families that we knew and were familiar with, and families we didn't know, weren't touching on the behavioral health system, probably wouldn't have touched on the behavioral health system had not the storm hit. And so, so that's the kind of thing you want to be thinking about. And how do you help people understand what trauma looks like? Be prepared for the first, right? So the first storm after Sandy, we really need to worry about that. The increase of calls to the hotlines and all kinds of other things were important. So those are the things to think about.
Thank you. And we're getting a lot of response. A lot of people wondering and want some more information about, we have upcoming webinar conversations, about COVID-19. So please be on the lookout for that. We'll have some information and links coming to you shortly. Right now, we don't have another question, so we'll give some people some time to, if they have any questions, just submit them into the chat. But if you guys have any other, some more information that you would like to share or any updates.
Sure. I'll take this moment to just say this is a time in which we need to think about how we can create some opportunities, right? From crisis comes opportunity. If we have the ability to ground ourselves well enough to think ahead, and this is an opportunity for that to happen. There are such amazing innovations that are happening. We should be attentive to those innovations. You need help with innovating. This is the time for that. And this is the time in which we can ground ourselves in making sure that youth and families are taken care of, that our staffs are taken care of, that our communities are taken care of. It's also a time in which we can find great innovations if we really spend some time thinking about them.
Great. And Stephanie, we will be sharing those links to all the upcoming conversations. The next one is going to be April 9th, supporting families. And then we have April 10th, which is residential treatment facilities. And we have more to come. So please be on the lookout for an email for that. Michelle, do you have anything else you'd like to add?
No, well, I would say that the most important thing that I think was communicated through today's webinar is that although this is a challenging time, you've got this. All of the information and the ways that you've been communicating with your audiences really remain relevant. And just think through what they most need, what they're telling you they need, and if you were in their shoes, what would you most want to hear right now? I think communication has become a lot more personal. Organizations that normally don't use you and we and I are using them now in your communications. And people really just need to know that you're there and that you'll be there when they need something. So it's important to put those messages out. And thank you for all that you're doing.
Great, thank you. I think we're about closing out right now. We have a lot of them. Thank you, Sarah, for putting all the links for everybody to continue the conversation and join us for future conversations. And I think, Denise, do you have any closing words you'd like to say?
Sure. Well, again, I want to thank Liz and Michelle Boardman for joining us today. I thank you again for resources that all of you have posted in the chat box. We will be sending a summary email out to all of you. We will also be sharing the webpage that will soon be up, maybe later on today. Who knows how many hours in the day are left. And I had just posted, I thought I posted Michelle Boardman's contact information, and let's put up Liz's as well. Of course, I can't talk and cut and paste at the same time, but I thank everybody for joining us today. We have also had posted in the chat box links to join our 2 upcoming discussions, and we just say to stay in touch. Also, remember the TA network is here for you on a broad-based basis across topics. Continue to reach out to your TA leads or to the TA network as a whole. So thank you, everybody. Stay safe, healthy, and happy, and we appreciate all of you doing this work in your communities.
Thank you.
Thank you.
Thank you.
Thank you.